Donnelly, please.
£5 million in Westminster.
Corla, tucked away in the outskirts of Galway City, is the Galway Autism Partnership. It's an amazing organisation providing really badly needed supports to children and parents. In Shankill, St Joseph's Nursing Home has revolutionised dementia care in Ireland. In Dublin City, the National Maternity Hospital now has a fetal MRI scanner, greatly increasing the ability to detect fetal abnormalities, and we have paediatric radiologists there who can use it. Carers, volunteers and healthcare professionals all over this country work hard, and every day they succeed in making our healthcare system better, more effective and more compassionate. But they do this not because of this government, but largely in spite of this government. The Galway Autism Partnership has exhausted its fundraising. It needs €70,000 per year from government to survive, or it's going to close in 6 weeks. So far, it has received no funding. St Joseph's in Shankill gets far less funding from the HSE than it pays its own nursing homes, and its model of care, which is revolutionary, is now at risk. In the National Maternity Hospital, the fetal MRI scanner lies unused because funding hasn't been released to run it. In the last 4 years, government spending on healthcare has increased by more than €4 billion. It's one of the highest anywhere in Europe. And yet, somehow, people in Ireland wait longer to see doctors and longer to get treatment than anywhere else in Europe. We have the second lowest number of hospital beds per capita. We have the lowest level of consultants in Europe. Mental health services are in crisis. General practice has been hollowed out. Some children with special needs are waiting 3.5 years for intervention. Children with scoliosis today can't get assessments for wheelchairs. 10,000 children are waiting more than 18 months for a hospital appointment right now. Why are these things happening? They're happening because this government has lost control of healthcare. First of all, it was going to scrap the HSE, then it wasn't. Then it was going to fund healthcare via universal health insurance, then it wasn't. Then it scrapped the board of the HSE, but last year, because of cervical check, decided it better put the board back in. They've now appointed the board. There's a 10-person board, and it turns out that not one person on the board of the HSE has a medical background. This year, of course, things have been getting even worse. January marked a new low, or rather a new high in the number of patients waiting for hospital appointments. That now stands at 523,000 people. Leo Varadkar, when Health Minister, set a target that no one would have to wait more than 18 months. Today, 100,000 people are waiting 18 months. Hundreds of GPs took to the streets outside Leinster House. The ambulance drivers took industrial action. The nurses and midwives took industrial action. The psychiatric nurses took industrial action. Waiting times for cervical check have jumped from 2 weeks to 6 months. 78,000 women are now waiting on results. The government announced that the HPV test would be in place by last September, then January, and the HSE told us just last week that there is no longer a date. Now, the Minister was asked repeatedly to stop the free test, and that is documented. But last week the Minister said in the Chamber that at no point was he ever given advice before the test not to proceed with the test. The date before the test was made, the clinical director of cervical check was on the national airwaves advising against out-of-cycle repeat smear tests, unless in exceptional circumstances. And on Sunday, Susan Mitchell wrote in the Sunday Business Post that cervical check did, in fact, advise against a free smear test, and did so before the government made that offer. Now, if this is true, then we need to know if the Minister has in fact misled the Dáil for a second time. And then, of course, there's the National Children's Hospital. 2016, it was going to be 650 million all in. It's now 1.7 billion euro and counting. Ken Corley, the two most expensive hospitals ever built anywhere in the world are in Adelaide and Stockholm. And the cost per bed for those two hospitals came in at 1.6 and 1.8 million euro. At the current cost, before it potentially goes up, the National Children's Hospital is going to come in at about 3.6 million per bed. So twice as much per bed as the 2 most expensive hospitals ever built anywhere in the world. Now, the government's response to this, when I've pointed it out to them, is say, yeah, but they're not children's hospitals. You have to look at children's hospitals. So let's look at children's hospitals. 4 years ago, the Alder Hay Children's Hospital was finished in Liverpool. It has 309 beds and came in at a cost of €270 million. That's a cost per bed of about €900,000. So, the taxpayers of Ireland, the citizens of Ireland, their public money is being used to provide beds in a children's hospital that cost 4 times more per bed than the NHS was able to deliver for children in Liverpool. Now, the government's response to this has been extraordinary. First, they kept the information to themselves. So while the Development Board hired a PR firm to gauge public reaction to the bad news, this House was kept in the dark. When the facts began to emerge, the first line of defence we heard was, well, this is due to inflation. It's unfortunate, but inflation is what it is, sure, what can you do? Now, in fairness to the Minister, he did accept last week here in the Chamber that actually it's not inflation that is driving this. Now, the government at the moment has quite an extraordinary line, which is they're saying, well, it's not really a cost overrun. It's that we underestimated the costs at the start. So regrettable, but obviously less grievous than just letting the cost spiral completely out of control, is we underestimated the costs. And defying all credibility, the government's current position is that at 1.4 billion, plus another 300 million to get it open, that still represents a reasonable cost to the Irish state. It's the government's position. Fianna Fáil does not have confidence in this government when it comes to healthcare. We don't have confidence now. We didn't have confidence last year when the waiting lists and trolley counts broke all records, and we will not be voting confidence in this minister. Why then, reasonable people ask, would Fianna Fáil abstain on the vote? Because to do otherwise is to trigger a general election. Now, what does that mean? That means no Parliament in place for 3 to 4 months. It means no parliamentary oversight of cervical check in getting that backlog eliminated. It means losing any chance of getting the costs of the Children's Hospital down, because what will happen when we all vie for votes is BAM, quite rightly, will continue to build, and the window of opportunity will be lost. It means no Irish Parliament in the closing weeks of Brexit. 45,000 jobs are at risk in every town, in every village, in every county. The Good Friday Agreement is at risk. Healthcare cross-border initiatives are at risk. The agri-food sector is at risk. No hard border around the 6 counties is at risk. Most people get this. Most people, while utterly frustrated with this government's performance on healthcare, agree that a general election in the closing days of Brexit would be madness. Not Sinn Féin, of course, but then we shouldn't be surprised by that, because Sinn Féin have been and remain the best friends the Brexiteers have ever had. Because of Sinn Féin, the only political voice from Northern Ireland being heard in Westminster is the DUP. And we all know how they feel about a hard border and about Brexit. Because of Sinn Féin, the people of Northern Ireland have no directly elected political voice in Belfast. And now, weeks before the Brexit deadline, Sinn Féin would like to complete their hat-trick and collapse the Dáil as well, taking Ireland away from the EU table while aspects of our future are being negotiated at that very table.
3 cross doubles and a treble.
Now this, of course, is Sinn Féin's choice, and they should be judged for that. Fianna Fáil's choice is to focus on eliminating the cervical check backlogs, to get answers on the National Children's Hospital, to keep the focus on reducing costs. Fianna Fáil's choice is to provide the stability Ireland needs right now to protect the country from the threats of Brexit. Fianna Fáil's choice is to present a credible alternative to the current government and credible solutions to the challenges this country faces in healthcare. Thank you.